Is there anyone we're expecting to be here for this meeting that is not here?
I think so.
All right. Well, welcome you guys. Thanks for coming to my birthday party.
Happy birthday.
Fun.
Wouldn't you know it that the thing I want to do on my birthday is talk about Unite for Safe Care. And, you know, it's my day, so my loves indulge me for sure. More than
Happy
that,
birthday,
though.
Wanda.
Oh, thank you, Agu. Thank you very much. So nice to hear your voice. You know, this has just been one of the most informative, inspiring, conversational days. And so what I proposed to Ariana, and she agreed to bring you all here, is I want the world to know about what you've done here, why you've done it, how you've done it. There's no way we can take 45 and now 40 minutes to convey it all, but I was hoping that I might just ask a few questions, start a little conversation, invite those who join us who are listening, Theodore, Janet, Agu, to use the Q&A to post any questions that you may have or any comments. And it is being recorded, so we can use this later if there's some place that you think it would be useful to just sort of show the back of the house as we are getting ready to make Unite for Safe Care a big, bold splash in tandem with World Patient Safety Day across the world. So how's that sound?
Sounds great.
Great. Why doesn't the PSMF team just introduce yourselves briefly, your name, your role, and something that's you're passionate about with Unite for Safe Care? Ariana, would you start, please?
Of course. So hi, everyone. I'm Ariana Longley, and I'm the Chief Operating Officer here at the Patient Safety Movement Foundation. Been here for a little over 5 years, and I'm passionate because we're all patients, or we could be if we aren't. So that's why I'm passionate.
Did you make that a crop top?
I did.
Oh, that's so impressive. That's just incredibly impressive. Hi, Rhoda, welcome. I'm going to bump you back over to an attendee role. I'm so glad you got to come back. Everybody say hi to my mentor of over 35, 36, 38 years. Very, 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 very long time. And my sailboat partner, those of you who've heard that I'm a sailor, this is my sailboat partner.
Hi, nice to meet you.
And you're on mute, Rhoda. So I'm gonna you're gonna get bumped over. And Rhoda, what we're doing right now is we are having a Unite for Safe Care meeting. And for some who were here earlier, they're gonna pop in as panelists because that's how they left. And then I'll move them back over to attendees. So thank you, Ariana. Lauren, how about you? What's your role at the Patient Safety Movement Foundation?
Making sure I was off mute. Well, first, happy birthday, and hope you're having a wonderful celebration. Thanks for including us today. But good afternoon. My name is Lauren Rayner. I'm the Chief Development Officer, and I've been with Patient Safety Movement Foundation for almost a year. In 3 days, it will be a year on September 11th. So, and I'm passionate about healthcare. I've been working with healthcare organizations for 15 plus years, and in the nonprofit community for over 25 years.
Lauren, I remember first meeting you at the mid-year planning meeting last year, and how exciting it is to just be here 1 year later when
I know,
we've accomplished so much in a year's time.
So much has happened in this past year.
Yeah, it sure has. Monica, I'm going to save you for last because I'm going to have you dovetail into something else. So Donna, how about you next?
Sure. Hi, everybody. I'm Donna Prosser. I'm the Chief Clinical Officer at the Patient Safety Movement Foundation. I am a nurse by background. I've been a nurse for 30 years, and I also spent several years as a hospital administrator in various roles. So, but what gets me really passionate about patient safety is my own personal experience that I've had on the other side of the bed many times. And so I understand what it is like to be a patient, a family member, a clinician, and administrator. So I'm here to try to help them all.
And Donna and her team put all of the actionable patient safety solutions together. There are over 30 of them, and they're basically peer-reviewed operational codes that any healthcare system can pick up and put into their system to help make their care safer around the world. How about you, Alyssa? Tell us what you do.
Hi, everybody. My name is Alyssa James. I'm the Program and Events Manager. I also handle marketing. I've been with the Patient Safety Movement Foundation for about 8.5 months. And I am passionate because when I started, I had no idea that what was going on in healthcare. And so I think it's so important to spread the word and to help save lives.
Thank you, Alyssa. And Natanya, hi.
Rhonda, happy birthday.
Thank you.
Hi, everyone. My name's Natanya, and I'm the Administrative Coordinator at Patient Safety Movement Foundation. I've been here since June, so almost 3 months now. And I'm passionate because it's just so inspiring being surrounded by like-minded individuals who want to better our healthcare system and reduce medical errors. Thank you for having me.
Thank you, Natanya. And Sarah?
Hi, everyone, and happy birthday, Vonda. I'm happy to join today. I am our Director of Partnerships here at the Patient Safety Movement. I've been here for a little over 3.5 years now. I think I'm the second oldest on the team in terms of, job timing here. But I'm passionate about everything that we do here because I've been a caregiver for both my father and my grandfather. And, at some point we will all be patients. So I want to learn the importance of advocating for my loved ones and for myself.
Thank you, Sarah. And last but certainly not least, the campaign director for Unite for Safe Care, Monica.
Hi, I'm Monica McDade, and I'm the campaign director for Unite for Safe Care. And one of the components is lighting up the world orange. And so I have committed to lighting up everything orange. And happy birthday, Vonda. And I have a little surprise for you. Hold on.
Woo! Oh my goodness, that's awesome. Thank you. Oh, Ariana's got one too.
What
You
are those
guys.
things?
They're poppers. They're
They're
streamers.
poppers.
Oh, okay.
Wow, you
Oh,
both just
awesome.
happen to
Yeah.
have streaming poppers. And Monica, this is a perfect entree. Monica stepped in December, January as campaign director, and Ariana and I were sweating bullets because we did not know what we were going to do if we couldn't find somebody to do what Monica has done. And you have constantly upped our game, including dyeing your hair orange. Like, I'm sorry, you've topped it out. I don't know how anybody's going to go beyond dyeing their hair orange, because I am certainly not dyeing my hair orange. That is not going to happen. So there are a lot of things I will do, and that is not one of them.
Well, when I
Feel
commit
you.
to something, I commit 100%. And so, if not now, when? And I think the thing that I have become most passionate about, oh yeah, the toes and the fingers are orange too, is getting the word out about this incredible mission, and how nobody knows about this, and that people are listening differently right now. So that's what I'm passionate about.
Yeah, thank you. Thank you. We have a lot of fun. Somebody said recently, I think it was actually a board member, which is saying a lot, that that they never thought they could have so much fun fundraising. So that's testament to Lauren to make things fun. We do have fun, and it's very serious business. Most of us have had an experience. Agu, who is here, has had experiences. He's an attorney working in 2 different places outside of the United States. And Rhoda and I have been through some major trauma together just a year ago when she went into the hospital, and I was a knowledgeable person to be by her side. And I got all of her little goddesses marching around her. I had them lined up, scheduled. She was never left alone in the hospital. We do this because we know it has to be done right now. We do this because we know that the actionable patient safety solutions and all of the information that is in those that Donna and her team are working so diligently on aren't pervasively included in systems across the United States and not across the world yet. And so until then, even though this is really serious business, I mean, Yogi Raj Charles's son is here today. Theodore Bates is here today. His father is not here because our care systems don't do so safely. So this is, even though we're lighthearted about it, it's also a very, very important matter. Janet and I have very serious. I mean, there's every single person here. I could tell you, and I won't because it's private, but I could tell you something meaningful about every single one of you. So here's what I want to do with the rest of our time. We have 30 minutes. I want the patient safety movement team to give us those top things that anybody can do wherever you are in the world that will help you become safer as a clinician, as a person who's giving care, as a person who is a patient receiving care, as a loved one who is home when those clinicians arrive back after being in a hospital with COVID patients all day without the proper PPE. I mean, just tell us, maybe each of you just name one thing that stands out for you that you've done in your work to help us all understand how important this issue is and why we can't give up our joy just because of it. I know that's a tall order.
Wash your
Monica?
hands. Wash your hands. This is not rocket science. Wash your hands.
Yep.
That is a big question. Go ahead, Ari.
Well, I was just going to say, I'll piggyback off of that because you can wash your hands. We all are taught as little children how to wash our hands, right? You have to wash your hands before you eat and after you go to the bathroom. And, you know, if there's something, get something on your hands, gotta wash your hands. That's huge because when you go into a healthcare environment, that's something that you know that someone else can do, and you know, pretty much how they should be doing it. So that's something that you can, in a respectful way, call your providers out on. If you see them coming to your bed and they touch a screen or something, then they come over to go touch your port or something, that's something that you can say, hey, I didn't see you wash your hands. Do you mind using some hand sanitizer real quick? Something that's not calling them out and saying, hey, you don't know how to do your job, but in a respectful way. That is something that you can call out, where there's many other procedures in the hospital that you have no idea what what points A, B, and C are supposed to be and in what order they're supposed to be done in. So I think that's something that has been really helpful for me, even in just going to my doctor and watching the nurse approach me to, do the blood pressure cuff and things like that, that we can all be empowered to do.
Great point.
I was going to say, just to ask questions and bring somebody with you that, just to not feel like you can't speak up if you don't understand something, or you're not, you don't necessarily agree with something, or you have been told something differently. I think to ask questions and to, be as informed as you can so that you are prepared for after as well, and symptoms and side effects and everything. So you have the full scope and you know what to look for and what to anticipate. I think it's helpful.
Good.
Yeah, that's very, very similar to what I was going to say, because, for when I was back in the 80s, when I was in nursing school, we were taught that we're supposed to create an individualized plan of care for every patient. In other words, what does patient A need and what does person B need, even if they're in for the same diagnosis, right? It's something that is a requirement in our standards, especially here in the United States. CMS says we have to have this individualized plan of care, but we don't. We plan by diagnosis. We we treat all patients that have a certain diagnosis the same way instead of treating every person individually. And so I think, and that comes down to the lack of care coordination that is in hospitals. It's, as you mentioned earlier, Vonda, the fact of the matter is it's not there. And we can wish it so, but it's not going to be so for a very long time. So we have no choice but to be our own advocates and be our own care coordinators and bring our own individualized needs to the forefront. So I agree with Alyssa, and in terms of asking questions, but also being very, very clear of this is what I need and this is what I want when you are asking the questions. And then also, in a very politically correct way, to insert yourself as an equal member of the care team. Yeah. Your care team is not a bunch of doctors and nurses who are overseeing your care and doing to you. You should be at the center of your care, and you should be they should see you as an equal member of that team. Mm. And that, I think even if you just go to a doctor and it's the first time that you're having a relationship and a conversation with this doctor because it's brand new, I think it's a worthwhile conversation to have, to say, let's talk about your how person-centered is your practice. How do you see the patient, and what role do you see the patient playing? Because if I feel that they really aren't feeling me being involved in this, then I'm going to find another doctor.
Yep. I do that now. I didn't before. I do that now.
I think what's been really eye-opening for me too, especially unfortunately with the pandemic, is I've spent my nonprofit career working with populations that don't have access to healthcare. Either it could be a street homeless or a low-income person or somebody that's underinsured. And I think that this past year, not only have I learned a lot about health safety issues, I have more of a community health center kind of focus, but what's happening in hospitals and what's happening globally. And I think that unfortunately with the pandemic, we're now seeing that the disparities, and that any of us could walk into the wrong hospital and not receive the best care possible. And so I think this has just been a really exciting opportunity for the Patient Safety Movement Foundation to really just kick up our awareness. And it's been a great opportunity. We have 1,600 new people that are going to be part of our organization. And that is huge compared to where we started a year ago. And this is a whole different population. It's just not healthcare workers, it's patients and people just like you and me.
Mm-hmm. I want to tag something on, Lauren. You said something really good, because I think sometimes it just reminded me, sometimes people think that, if you just go to the upper echelon hospital, you just go to that hospital that's really well known and fancy in your community, that you're going to be fine. And, I have the best surgeon, or I have the best whoever. It's not about your one main provider. It's about that whole team that's going to care for you. And it's about that culture inside of that hospital. So, there's a lot of tools out there, from the Leapfrog group to Hospital Compare on CMS's website, that you can use, health grades for you to search your individual practitioner. But I think sometimes people just have this idea that they have this wonderful doctor, and you may have the most brilliant neurosurgeon that's going to operate on your brain. And afterwards, if that one person forgets to wash their hands that comes over to you, it could all go awry. So I think it's just a humbling thing to realize that it's a whole system. There's a whole group of people who are going to be caring for you, especially in a hospitalization, that it's not good enough to just have a good doctor. You have to have a good system that's going to support that doctor and that nurse if something does happen.
It's a great point.
And I think, it's going to be organizations like us that are going to help hospitals to get there. But I think it's important for everybody to understand too, that the big organizations like Intermountain and Kaiser and, Mayo Clinic, Cleveland Clinic, they're far ahead of the curve than some of our smaller community hospitals. But no hospital is perfect. Every hospital has pockets of goodness, but no hospital is perfect. So I think, in my mind, whenever I go into a doctor's office or a dentist's office or a hospital or anything, I automatically assume, okay, I'm in unsafe territory now. And and if I make that assumption, then I'm more likely to catch errors than to just assume that they're going to do it right.
I do see that there was a question from Janet, and Donna, you may want to help answer this. So with the disparity of care due to the disparity of the wealth level of a hospital, how does the Patient Safety Initiative plan to get the word out, COVID, for example, with Black and brown populations?
That is so weird. I cannot see questions anymore. This is the second time this has happened where somebody else sees a question. I'm so glad you noticed it. And you are on mute, Donna. You accidentally just went on mute.
Yeah, I think, Janet, you're so very right about that. And one of the things that we've started is having some really pretty significant conversations about social disparities that we really weren't getting into before. It's a little bit of it's kind of muddy waters because we have to be careful about what we might say to offend certain people, but it has been very well received. I'm surprised at just how much we've been able to accomplish and talk about. So I think for our purposes, what we want to do is we want to target those hospitals that are not the big Mayo Clinics of the world who need help. Mayo Clinic, Cleveland Clinic, Intermountain, they can afford consultants that do what we do. They can pay them millions of dollars to come into their organization and help them to improve safety. But the small community hospital down the street that doesn't have those deep pockets, that's in a Black and brown community, they don't have that. So that's what we want to do. We want to provide coaching for them virtually. And in addition, we're going to continue to have these ongoing conversations about social disparities and how that individualized plan of care fits into that conversation.
That's a really good pivot toward another question that I thought would be really helpful for this assembly, and that is focusing on the Unite for Safe Care campaign. It has evolved from, an assembly of 60 people across the world giving their ideas and making recommendations, and then new iterations. Monica has adopted a new middle name. She calls it Pivot. It's now Monica Pivot McDade. What have we pivoted to? What do you think are some of the key pieces that we're paying attention to with the Unite for Safe Care that will help do what Janet's referring to in that question of get the word out, not just in hospitals, not just with clinicians, not just with administrators, but with everyday people, so that people like myself don't walk into the hospital blind. And I'm not the only one. Almost everybody I talk to who's experienced some sort of harm in their family said, yeah, had no idea until it happened to me.
Well, I'm happy to start off. I think one real simple thing that we did was we launched Unite for Safe Care as a website. The Patient Safety Movement Foundation was always really used to communicating with people who were already in healthcare, stakeholders, associations, professional societies, hospitals themselves, administrators. So the Patient Safety Movement website was mainly, speaking to people who already were in the know. So with the launch of this campaign, I see Unite for Safe Care as almost the consumer website that breaks down a lot of these ideas and concepts into an easier way to understand and be able to share that information. So I think that was kind of step one. How do we break this down so that your neighbor or your cousin could understand what we're talking about? Because it was a lot harder to do that just from the Patient Safety Movement Foundation's website. So that's one thing that comes to mind mostly because my head's in marketing most of the time.
I love the way you put that, Ariana. I've never really thought of it that way, but you're absolutely right. It needed a whole new language set.
To piggyback on that, we intentionally and have hopefully thoughtfully have included that in the virtual event as well. That it was very important for us to address that outward facingly to the public, to talk about, we see you, we hear you, we know that you don't feel seen or heard. And So I hope that that segment in the virtual programming comes off and inspires others to, you know, advocate for themselves, seek out more a second opinion, or, you know, not put off the healthcare that so many are waiting for it to get safer. And that if we all wait, it might be a long wait.
Yeah. So just for context, in case there's somebody listening now or later who doesn't know about the virtual event, somebody give us a 2-minute little snippet on what we can anticipate.
You're going to need a box of hankies, Kleenex, and you will probably laugh. You'll be inspired. You will definitely learn something. And the variety and capacity of experience with all of our speakers is tremendous. It's a very diverse program. We think it's reflective of voices from around the globe speaking out and speaking together. And I think the fun piece for me has been watching Vonda. You, as a force of nature, kept telling me all along, I want this to be global. It's bigger than just the United States. And I kept saying, I don't see how we're going to pull that off. And yet we are. So, and that we're locking arms with other partners and co-conveners and saying, enough. This has got to change. We can't do this way anymore. And so hopefully that's what people walk away with, is that fortified, okay, I can be part of a solution that's been a really big problem. Team, anything else you want to add to that? What do you think is going to happen on the 17th?
I'm going to, oh, go ahead, Ariana.
No, I was going to say you did a beautiful job, Monica.
Yeah, it was very thorough, and it gives me a little bit of a bridge into something that I heard Donna speak to earlier, and it also links to the meeting that I just had with the Achula founding team. Again, Achula after caregiving harm a loving approach, and when COVID happened and the social injustice and racial injustice uprisings started to happen, we took a pause, and in doing so, we reoriented to our relationships. There are just a handful of us who are founders of that organization, and we were flying, we were on a roll, we were doing great things, and we could have, like a lot of organizations, just kept on moving, and we probably might have even been successful. But we knew that at the fabric, that if we continued to do that and we didn't do a little bit of a pivoting, we might tear at the fabric of our own relationships. So we prioritized what Yogi Raj Charles Bates would have called a we. We have a we, we're called founders, and we prioritize us over our outcomes. Our metrics and our mission have to line up. And the reason I say this is because what I acknowledge of not just Unite for Safe Care, but Donna mentioned it earlier when you were talking about going into an environment, and that patient needs to be at the center of care, and that a lot of systems have not been designed to do that. Because honestly, even as a human, it's kind of difficult to do that sometimes. So even if you have the best interest and the best intentions to do that, it's not necessarily easy if you're working in a system that doesn't support that. And so I want to tell you, I want to go way back to 5-6 years ago when I first sat in my first Patient Safety Movement World Patient Safety Science and Technology Summit. Joe Kiani, the founder, standing up on the stage, and he uses the L word, the LOVE word, and he uses it sincerely, with heart and soul. He is not faking it. I can tell this is how this man operates. And I had kind of gotten an inkling of it from afar, from a distance, because in my network, earlier at noon today, I met with colleagues who consciously create businesses. And by that, I mean, they don't create a business to create widgets. They create businesses to help and serve people, period. If it doesn't do that, they're not interested. And I could tell that that was a persona standing on that stage, and that was a persona exuded from the organization. Now, flash forward, here we are. It's been 6 years, I think, later. And Unite for Safe Care, in my mind, Monica, you just described an organization, a campaign, a mission that's metrics are driven by relationship. They are driven by connection. They are driven by meaningful change and not just perceived change. And that you, over the last year, every single person who's here listening today or engaged here today and listening, have been a part of choosing connection over a lot of the other things that might go in that category that are typical and honestly reasonable. I'll just name a couple of them. What's the word I'm looking for? You know, my reputation, am I part of an organization that is scary, that is going to disrupt things? There are a lot of people who don't join the Patient Safety Movement Foundation's efforts because it's a disruptor. So I just want to acknowledge you and thank you for adopting that LOVE at the heart of what you do. I know it comes from your inception. I know that it is in each of you. And I know that it will make a huge difference in terms of the work that we can do together. And now I'm going to start to get a little choked up here. But I've never actually worked with an organization, hopefully other than my own. You know, maybe not, who knows? I'd have to get some outside input on that one. But you walk your talk, and the organization walks its talk. And I just want to thank you for that, because I think it's actually going to do more than save lives. It is actually going to mitigate a lot of suffering, especially for the clinicians who go out there every single day, and the administrators who are often, like Donna, they started as clinicians and now they're in an administrative role. They go home to families, they go home to loved ones or pets, they go home to their sourdough starter. That's a shout out to somebody who's here right now. They go home to their environments, and they need to know that they are loved and that they are cared for. And this is an organization that has done that thoroughly, through and through. So just thank you. That's my only little spiel. Let me ask you one last question before we close. We've got about, we've got a few minutes here. I would like to ask you, what was hard about this year? What was challenging? Just name one thing that maybe it was a learning for you, you know, one of those sticky challenges that you learned from. Show us something real about what you've just done with this accomplishment.
I'm gonna say, go ahead.
Some of us on our team are a little bit older, and older dogs don't always learn new tricks quickly. And so for me, learning 12 new applications in a short period of time to get up to speed was, as all of you know, a challenge. But you've made me better, truly. I mean, you have nudged and pushed and cajoled and waggled your fingers, but you've made me better, and I am so grateful for that, and the privilege of working alongside these dedicated volunteers who are all in, even if they're unwilling to go orange, they're all in, and they are passionate, and some of these stories are just heart-wrenching. So my main goal with any event is goosebumps, and if you get goosebumps, then we've succeeded, because we want to touch hearts and minds, and that is how you make change happen. And so Yeah, I'm not going to remember the Margaret Mead quote that Marty always uses, but it's, you know, it's the small group that makes the difference. And so thank you, all of you.
Mm-hmm.
Yeah, I was also going to say technology.
I heard that word.
Yeah. Yeah, technology definitely has been a challenge. As Monica said, some of us are, you know, I used to be the young whippersnapper that could do what Ariana does. And so it's really, really hard to be now on the other side of that age divide where I'm no longer the young whippersnapper that knows how to do all this stuff. But I know, you know, so that, but, you know, as Monica said, it's made us a better organization. I mean, I was hired to travel around the world and talk to people about the Patient Safety Movement Foundation. And then the pandemic forced us to do that virtually. And so now, because the pandemic forced us to do this, we're doing things that we didn't do before, and we're able to touch so many more people in the process because I'm not just flying around and going to one particular organization, not to mention the cost savings involved.
Yeah. You have a whole library. You've built a library in 6 months that is impressive, and I'm on the committee that looks at the future, and you've got twice that much on the docket coming up. So
thank you, Ande. Yeah, but we couldn't have done it without you. So, and everybody else on that education committee. You guys, I mean, it's not just us. It's everybody that is in this network. When we email or we call and we say, "Can you please help us with X?" And everybody's like, "Absolutely. When do you need it? Next week? No problem." So it's amazing.
Thank you. Sarah, it looks like you might be jumping in here. Is that right?
Yeah, I've been having issues with muting and unmuting. I keep trying to say something and I realize that I don't know if I'm on mute or not. But thanks to Ariana, since I've joined, I'm very tech savvy. I've always kind of been, but I think that with her skills with being a whiz at a lot of different things that I thought that I was good at, but I wasn't as great. That's been a really good, benefit of working remotely. I think that our team has really learned how to work together virtually. But I will say, my biggest challenge with COVID hitting is just not being able to see people face to face. Obviously we're a very small team, so we were so used to seeing each other each and every day. And when we would have bad days, just, having a hug or just talking it out with someone in person was a really great, uplifting thing to have. We've had interns over the last couple of months that we have had them come in and they've had their last day, and we unfortunately were never able to meet them. So I think that's just been a challenge for me is, not being able to have those conversations in person. And, the summit being canceled was obviously a big disappointment. And that's the one event every year that really kind of reminds me that all of our hard work is shown. So I'm really excited to see, how this virtual campaign plays out and bringing together everyone virtually. I mean, I know Ariana noted this, but we have more than double the amount of RSVPs than we've ever had for the summit. So I think that this will be a new page to turn with everything being virtual.
It's inspiring to hear that.
I'll go next, Vonda, since we're short on time. I think for me, I've loved the technology because I've had been begging for 7 years for a Mac computer. And so, because I knew that our organization was behind the times. So thank you for the challenge, Ariana. I may stumble a couple times, but I will learn it. So thank you. But I think for me is, especially as a fundraiser, is hearing the stories. And that's always been a part of my career. Last place I worked, we ran a campaign, Not in Her Shoes. But I think that really is applicable for now. You never know when you might get on the phone with somebody that may share the stories. And I think it's to share stories that really inspire people, not one just to get involved, but to also learn more as well. And of course, I'm a fundraiser, so of course I have to push the donations as well, but you never know when you're on the phone. And I think just one good example is I spoke with a marketing director at the Orange County Soccer Club, and we were talking about planning an event to raise money for our organization. And he ended up telling me a story about what he was experiencing right now with his grandmother. And so you just never know. And I think that's the importance of it. You know, we've all experienced medical harm, either ourselves or our family members. We may not share those stories. We may not be aware of those stories, but it's the sharing the stories and the connecting that will really move our mission forward. And we'll be able to make huge, successes. And I think this is a great start with our Unite for Safe Care campaign.
I'll be super brief. The thing that I think has been hardest is making everyone happy. So it's really easy to make like 3 people happy. There's like just a little bit of compromise that has to take place, but when you have 80 people who are on a committee, many committees together, it's just harder to make everyone happy. But I think we did just as good as we, as we made it almost perfectly. We came up with a name that now Unite for Safe Care has, as of this point, no one fighting that name. But it's been challenging. And the thing that I've learned from it is, just to listen. It's definitely helped my ability in being able to listen to people and hear them out and hear their rationale and reasoning and then figuring out how to compromise from there. But it's just hard when you grow. So it's a good problem to have.
I want to underscore your listening. I am often one of those people who says, "Oh, I don't know about that idea," and and you guys are kind enough to solicit a lot of feedback, and I'm not shy, as you know. But you're listening, and so when somebody listens well, for me anyway, it's much easier to let go of when it doesn't look like I want it to look. It's much easier to let go because I know I've been heard and I know I've been sincerely considered, along with those other 80, 800, 8,000. Let's talk about 8 million people that we want to try to not please, but we want to make sure that their lives are healthier and safer across the world. I want to close today if I could, and I'm sorry for those that I didn't hear from, but I do want to take this opportunity to give 2 minutes, and if you have to jump off, I understand, but I created a little PowerPoint that I've been playing between my meetings. I've given myself 15 minutes between every meeting. I don't know if you saw that schedule, but it was kind of intense. And I just want to go through this really quickly while you guys are here, if you can stay on, and if you can't, again, don't worry about it. But let's just start with this. So here are some things that you can do if you want to unite for safe care. You can light up the sky, your house, your front porch, your car, if you're like me traveling across the country, light it up orange on September 17th. You can and here's the thing, if you subscribe to 10th Dot's YouTube channel and you send me your address, I will send you an orange light bulb. So that's my commitment to you. All you have to do is subscribe to the 10th Dot YouTube channel and send me your address, and you are going to get a light bulb you can put on September 8th. That YouTube, you just look up Vonda's Zigzag for Zero Journey to Capitol Hill on YouTube, and you'll find me there. This is something else you can do. You can just go to this little thing right here, or just go to uniteforsafecare.org and you'll find an RSVP to the virtual event on September 17th. You can see that this is just a smidgen of all the people who are going to be making presentations on that day. And as Monica said, get your Kleenex box out because that's going to be important that day. You can make your motions count by joining Mask for Miles and Charity Miles. You can join my team. Here it is right there. And I'll continue to rotate those later so that you can see that if you didn't get the HTM, whatever, the website there, the URL there. Call your local legislators and you tell them you want a national safety board to ensure that everyone who receives and gives care gets safe care. Ask them to meet with me or other advocates like me for safe care. Call them today and just let them know we're coming to DC, not for you, but with you and united for safe care. You don't need that. Let me see if there's, call your local media outlets. There's a media professional here I got a lot of advice from, Janet. In fact, she's on that YouTube channel. You can also make a tribute to somebody that you know who's witnessed or experienced harm from medical errors. And with that in mind, I just want to tell you guys, thank you so much for taking this time today. I will send you the recording of this in case your magical real professionals can do something with it to help us make this next, what do we have here, Monica? Monica's been counting the days. We have 9 days, is that right? Well, we're here. This is the launch of a 9-day campaign between now and September 17th. And this team has been doing everything in their power to make this effective. And I just am so grateful to be able to be with you today. And for those who stayed on to listen and ask their questions, thank you for being here too. And for those who are listening later, thanks for taking the time.
We love
Thanks
you,
for sharing
Vonda.
your birthday with
Yes.
Happy birthday, Vonda.
Thank
Happy
you.
birthday.
You
Only
guys
you
made
would
it the,
plan such a wonderful birthday for yourself.
thank you.
Thank you so much for
Thanks
making
for
this
all you
happen.
do.
It's been
Bye.
Bye.
it's been a true joy. Bye everybody.
Bye.
See you.